Antihypertensives are a class of medication used to treat hypertension or high blood pressure. Certain antihypertensives act upon the renin-angiotensin-aldosterone system to decrease blood pressure by inhibiting vasoconstriction and water reabsorption in the kidneys. Hypertension affects over a billion people around the world, and it's a major risk factor for heart disease and stroke. Blood pressure is the force that blood exerts on the walls of blood vessels. Now, there are a number of factors that determine blood pressure. For example, imagine a hose connected to a pump, where the hose is the blood vessel and the pump is the heart. If more water is pumped out, the pressure in the hose increases. Now, if we squeeze the hose, narrowing the diameter, the pressure inside would be greater and the water will shoot out more strongly. This is similar to how the diameter of the blood vessels can affect blood pressure, which can change in response to different stimuli. One important mechanism that regulates blood pressure is the renin-angiotensin-aldosterone system, or RAS for short, which is a cascade of events that ends up increasing blood pressure. When blood pressure is low, blood flow to the kidneys decreases. The kidneys respond by secreting renin into the bloodstream. Renin is a proteolytic enzyme that breaks down a protein made in the liver called angiotensinogen, and this gives rise to angiotensin 1. When it reaches the lungs, angiotensin 1 is converted into angiotensin 2 by an enzyme called angiotensin converting enzyme, or ACE for short. Now, angio refers to the blood vessels, and tens, well, it means to tense. So angiotensin 2 binds to receptors in vascular smooth muscle and causes them to constrict, which increases blood pressure. Finally, angiotensin 2 also stimulates the release of aldosterone by the adrenal glands. Aldosterone increases reabsorption of sodium in the kidneys, which also increases water reabsorption. This results in increased blood volume, which also increases blood pressure. Now, there are three main classes of medications that work against or antagonize the RAS. First, there's direct renin inhibitors such as aliskiren, which are relatively new compared to other antihypertensives. Aliskiren binds really tightly to the active site of renin enzymes. This blocks angiotensinogen from binding, so angiotensin 1 levels fall. Aliskiren has a long half-life, so one tablet taken per-oral daily is enough. But since it's younger in the medical field, it hasn't been as extensively tested, so it's commonly used for patients who don't respond to other antihypertensives, or it can be given in combination with other antihypertensives. In addition, aliskiren can cause GI side effects like diarrhea and abdominal pain. Other side effects include headache, dizziness, and fatigue. Okay, so next we have the angiotensin converting enzyme inhibitors, or ACE inhibitors, and their names usually end in pril, like captopril, enalapril, or lisinopril. So by inhibiting the action of ACE, they prevent the formation of angiotensin 2, and therefore decrease its level in the blood. With less angiotensin 2 in the bloodstream, there is less vasoconstriction, and therefore these medications effectively lower the blood pressure. In addition, they lower aldosterone release, which causes natriuresis, or excretion of sodium, by the kidneys. Captopril should be taken 2 to 3 times daily because it has a short half-life. But enalapril and lisinopril are highly potent and have a longer half-life than captopril. Because ACE inhibitors are effective in lowering blood pressure, they can be used not only to treat hypertension, but also to treat heart failure, where the heart isn't strong enough to pump out an adequate amount of blood. In this situation, the decreased vasoconstriction leads to decreased peripheral vascular resistance and afterload, so the heart doesn't have to pump as hard against that resistance. ACE inhibitors should also be given right after someone suffers an acute myocardial infarction in order to increase the perfusion of the heart to prevent further ischemic damage. Most ACE inhibitors are taken by mouth and they are eliminated by the kidneys, so care must be taken with people that suffer from renal impairment who must receive lower doses. Now, the most common side effect of ACE inhibitors is a dry cough. Normally, ACE also breaks down bradykinin, so when the person takes ACE inhibitors, bradykinins accumulate and they're thought to induce the cough reflex. Another more rare consequence of bradykinin accumulation is angioedema, a painful swelling in the airways that's life-threatening. Other side effects include hypotension, but it only happens when the person starts taking the medication, then eventually disappears. Finally, people using ACE inhibitors should avoid a high potassium diet because there's decreased aldosterone production, which means there is less potassium excretion in the urine, and this could lead to hyperkalemia. Finally, we have angiotensin II receptor blockers, or ARBs. They bind to angiotensin receptor 1 on vascular smooth muscles and the adrenal glands, which prevent angiotensin II from binding. This results in decreased vasoconstriction and decreased aldosterone synthesis, respectively. ARBs end in sartan, like candesartan, valsartan, and losartan. They have the same indications as ACE inhibitors and can also be used to treat hypertension, heart failure, and MIs. Unlike ACE inhibitors, they don't increase bradykinin levels in the blood. Hence, they cause less cough and angioedema. Other than that, the adverse effects of angiotensin II receptor antagonists, just like ACE inhibitors, are hyperkalemia and hypotension. Despite having an apparently safer profile than ACE inhibitors, angiotensin II receptor antagonists are the medication of choice only if ACE inhibitors cannot be tolerated. Candesartan and losartan have a relatively long half-life and can be taken once or twice a day, while valsartan is given once daily. Finally, none of these medications we've discussed so far should be given during pregnancy because they can cause congenital malformations in the baby. If an antihypertensive is needed, the pregnant person should be switched to medications like methyldopa or labetalol. Now, let's make a simple and fun mnemonic that'll help you efficiently memorize these farm facts. So let's go to the Raz Ski Lodge that sits halfway up a hill. First, there's a large blood pressure cuff that sits on the top of the hill to remind you that these are medications for hypertension. For the mechanisms, there are reindeer for renin near the top of the hill. By the lodge, there's a magician with a giant ace of spades representing ace. And at the bottom of the hill, there are 2 angel statues for angiotensin II receptors. By the reindeer, we have a skiing alien for Alice Skiren. It's trying to abduct the reindeer by shooting it with some sort of abduction ray. This made the reindeer dizzy and also poop, which represents the side effects of Alice Skiren. By the magician with the ace of spades, we have the ACE inhibitors that end in pril, so we'll use the jester or fool for April Fools. He's trying to learn a couple of tricks from the magician, but it's very cold and he developed a cough, which is a side effect of ACE inhibitors. He's coughing so hard that he can barely breathe, which will help you to remember the more serious side effect of angioedema. At the foot of the hill by the angel statues, we have a man dressed as Santa, and he represents the ARBs that end in sartan. Now, remember that ACE inhibitors and ARBs can be used to treat MIs and heart failure in addition to hypertension. So let's have a big heart drawn in the snow between the magician and the statues. A mischievous kid is vandalizing it by giving it a big F for failure, and he's hitting it with a stick for heart attack. ACE inhibitors and ARBs also share some of the same side effects. So let's have the kid's bigger brother slipping on a banana, representing hyperkalemia, and he fainted, which represents hypotension. Finally, skiing all the way down from the top of the slope, we have a pregnant lady who's out of control. She regrets coming to the slopes, and this will help you to remember that all 3 classes of drugs are contraindicated during pregnancy. Alright, as a quick recap, angiotensin and renin antagonists are a class of medications used to treat hypertension or high blood pressure. They work at different levels of the renin-angiotensin-aldosterone system that normally regulates blood pressure. The 3 main classes of medications include renin inhibitors, ACE inhibitors, and angiotensin receptor blockers. ACE inhibitors and ARBs can be used to treat heart failure and MI, but ACE inhibitors cause coughing and angioedema. None of these medications should be given during pregnancy. But wait, there's more. Here's a mind map with all of the mnemonics from the video. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers at the end.
Diuretics are medications that act on the kidneys to increase production of urine, and therefore elimination of water from the body. There are 5 main types of diuretics: carbonic anhydrase inhibitors, osmotic diuretics, loop diuretics, potassium-sparing diuretics, and last but not least, thiazide and thiazide-like diuretics, which we'll get intimately acquainted with during this video. Now, the basic unit of the kidney is called a nephron, and each nephron is made up of a glomerulus, which filters the blood. The filtered content goes through the renal tubule, where excess waste and molecules, such as ions and water, are removed or filtered through an exchange between the tubule and the peritubular capillaries. So the renal tubule plays a huge role in secretion and reabsorption of fluid and ions, such as sodium, potassium, and chloride, in order to maintain homeostasis, or the balance of fluid and ions in our body. The renal tubule has a few segments of its own: the proximal convoluted tubule, the U-shaped loop of Henle with a thin descending, a thin ascending, and a thick ascending limb, and finally, the distal convoluted tubule, which empties into the collecting duct, which collects the urine. Alright, so thiazide and thiazide-like diuretics are taken perorally, and once in the blood, they travel to the kidneys where they're secreted by the proximal convoluted tubule into the lumen of the renal tubule. An important point to make here is that they are secreted by the same secretory system that secretes uric acid into the tubule, so they compete with the secretion of uric acid, therefore increasing uric acid levels in the blood. Next, they travel along the filtrate until they reach the distal convoluted tubule. This part of the nephron is lined by epithelial cells. Now, on the luminal side of these cells, there's a nifty little sodium chloride symporter. This channel reabsorbs one sodium and one chloride ion together from the tubule into the cell. Sodium is reabsorbed along with water into the interstitium and then into the bloodstream. This tiny cell also has a calcium channel on its luminal side, which allows calcium from the lumen to diffuse into the cell. Once in the cell, calcium is transported out into the interstitium through a sodium-calcium exchanger that pumps a sodium in and a calcium out. Now, since thiazides decrease sodium reabsorption, there's less sodium in the cell, so the sodium-calcium exchanger works overtime to pump more sodium in and more calcium out. The decrease in intracellular calcium, in turn, leads to more calcium reabsorption from the urine. Okay, so let's meet our diuretic team here. But first, what is a thiazide and what is a thiazide-like diuretic? Well, all these medications have the same effect. The difference stems from their chemical structure. Thiazides are benzothiadiazine derivatives, like chlorothiazide and hydrochlorothiazide, and they all end in thiazide. Whereas thiazide-like diuretics, like metolazone, indapamide, and chlorthalidone, are sulfonamide derivatives. Now, the major indication for diuretics is the management of hypertension and edematous states. Since these medications cause water loss through the urine, it leads to decreased plasma volume and cardiac output, resulting in lower blood pressure. This also treats edematous states like pulmonary edema or ascites, where fluid builds up in the extracellular space. These medications are less potent in their diuretic effect when compared to loop diuretics, but they're much longer lasting. Thiazides are used mainly as first-line antihypertensive agents, since they decrease plasma volume. This also makes them useful as a second-line therapy to treat edematous states caused by conditions like heart failure or cirrhosis. Since they increase calcium reabsorption, they can also be used in individuals with calciuria to prevent calcium nephrolithiasis or the formation of calcium oxalate kidney stones. Preventing calcium loss can also slow down the progression of osteoporosis. Finally, an interesting indication is nephrogenic diabetes insipidus, which is where the kidneys don't respond to ADH, so they can't reabsorb water in the distal convoluted tubule and collecting duct, and thus eliminate huge amounts of dilute urine each day. However, individuals usually compensate by also drinking huge amounts of water throughout the day to replace the losses and maintain blood volume. So why give these people thiazides if they're already eliminating so much urine? Well, thiazides induce a mild hypovolemia, and this makes the kidneys respond by absorbing more sodium and water in the proximal convoluted tubule. With less fluid reaching the distal convoluted tubule, fluid balance is maintained. However, thiazides do come with some side effects. First off, they tend to tamper with sugar and fat metabolism, causing hyperglycemia and an increase in serum cholesterol and LDL. They also cause more calcium and uric acid to be retained in the blood, so hypercalcemia and hyperuricemia are a risk. Chronic hyperuricemia could also lead to gout. Since thiazides increase sodium loss in the urine, short-term use causes hyponatremia. To make things worse, increasing urine output can cause hypovolemia, which in turn triggers the secretion of antidiuretic hormone or ADH. ADH binds to specific V2 receptors in the collecting duct and retains more water relative to sodium, diluting the blood and further lowering the sodium concentration. Another interesting side effect is something called hypokalemic metabolic alkalosis. Hypokalemic means low serum potassium, and metabolic alkalosis refers to an increase in blood pH, which is caused by either too much bicarbonate or too few hydrogen ions in the blood. This happens because an increased concentration of sodium ions in the collecting duct make the collecting duct secrete more potassium and hydrogen ions from the blood and into the urine. Finally, people with allergic reactions to sulfonamide medications may develop an allergic reaction to thiazides and thiazide-like diuretics. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these pharm facts. Let's have a psychic for the thiazides, and she's holding a seance for her client who represents the thiazide-like diuretics. The client is Indian, for indapamide, and he's holding a metallic laser gun for metolazone, while eating a bowl of colorful salad for chlorthalidone. On the table, there are a few objects representing the indications for these medications. First, instead of a crystal ball, the psychic is using a water balloon sitting on top of a blood pressure cuff, which represents the edematous state and hypertension. Next, there's a milk bottle with a kidney stone, representing calciuria, and a bone full of holes, representing osteoporosis. Finally, there's a sippy cup for diabetes insipidus. The side effects will be represented by the ghost they summon. This ghost with red rashes is sitting in a hot spring with the sulfuric smell of rotten eggs, because these medications can cause a reaction in people with a sulfa allergy. His fingers are swollen with uric acid crystals sticking out for hyperuricemia and gout. Next to him are the unhealthy foods that led to his death. On one side, there's a huge stick of butter for hyperlipidemia and a giant candy bar for hyperglycemia. There's also a box of baking soda with a banana peel on it for hypokalemic metabolic alkalosis. On his other side is a short and empty salt shaker, representing hyponatremia. Alright, as a quick recap. Thiazide and thiazide-like diuretics are medications that block the sodium chloride symporter in the distal convoluted tubule in order to increase urine output. The most commonly used thiazides are chlorothiazide and hydrochlorothiazide, and the most commonly used thiazide-like diuretics are metolazone, indapamide, and chlorthalidone. They're mostly used as first-line antihypertensive agents, but can also be administered to reduce edema in heart failure and cirrhosis. They also increase calcium reabsorption, so they're used to prevent calcium kidney stones and osteoporosis. Finally, they can correct the imbalances in nephrogenic diabetes insipidus. Common side effects include hyperglycemia, hyperlipidemia, hyperuricemia, hypercalcemia, hyponatremia, hypokalemic metabolic alkalosis, and sulfa allergies. But wait, there's more. Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself and see what you remember. Stay tuned for the answers after the credits.